Hello, everyone. Good evening. I'm Asli Pereira from BML College of the United Kingdom. And today's live session is about Level 3 Diploma in Health and Social Care. Stay tuned. I'm going to give you more information about how you can join our courses and what is the recognition, how much it's going to cost, and what are the benefits of doing these courses. BML College is established in the UK since 2011-2012 period, and we have been established different parts in the world. Like in Sri Lanka, we have a campus, and we have a campus in Birmingham. So if you are someone who want to study on campus, we have facilities to cater students in our Birmingham campus and in Malabar campus. So if you really want to apply for on-campus courses, just let us know. You can apply online, and a member of our staff will be contact with you for further steps. If you want to do online, then a lot of people do online courses these days because of their work schedules and the timing, the distance, the travel costs, and they want to save money on travel costs and things like that. So they want to do blended learning. A lot of blended learning options we have with students, and some of the students want to do 100% online because of their working schedules, because we have the professionals who are working already full time are the ones who are doing these courses. So if you want to start studying a course um, at an affordable price, so online BML online is open for anyone in the world who are eligible to join our courses. So you have to send your CV to admin@bmlcollege.com, and a member of our staff from the admissions team will be contact with you to see whether you're eligible for the particular course, and whether we can help you with any scholarships. We have up to 50% of tuition scholarships for all students applying for this year. So let us know if you want any help with regards to financial help with your tuition fees. We have up to 50% scholarship for online students. So anyone from anywhere in the world can apply to study at BML College. We have supportive teams and the qualified lecturers. We give one-to-one personal tuition. So if you want to apply and start doing a qualification, UK qualification, do it, start doing your course, and we have one-to-one support from our lectures. You can block sessions and get personal attention, personal tuition to complete your qualifications. We are flexible and available. There are lots of students are completing the qualifications because it is very important, especially when you're in the UK. You need to have a qualification to get into a job, so it's very important. And also, you need to develop your skills, understanding, knowledge, and employability skills in order to get a job of your preference. So, at PML College, we take pride in giving you flexible and accessible and affordable tuition for your higher education. So you can contact us on admin@bmlcollege.com. We can get you more information, and we have friendly teams, qualified tutors to get you the support and the guidance you need. A lot of people find it very flexible, and you can complete these qualifications at your own pace and process. So I think it's very important for working people, working full time working people, parents are actually finding it very easy and flexible, and also our qualifications are recognizable, so it's of course regulated awarding bodies, and we have very close relationship with our awarding bodies. We are continuously improving our education system. We have the materials, learning materials and systems in place. We have the support and staff to support you all the way. So we are continuously improving our quality of education, because that is the ultimate goal of any educational institution, because who you become through education is what matters. We believe we believe quality education should be affordable and accessible to the world, and we also believe education is birthright. Every one of you should have access to education, because it's not a privilege, it's a necessity. So you need to be educated. You should have information, the knowledge and understanding, a place where you can rely on and get educated. So we think it's a birthright. So every one of you have right to get good education. So we believe high quality UK education should be affordable and accessible to the world. So that's why through BML College we make it very affordable and accessible to anyone in the world. So anyone in the world, you can join our courses. So how you are going to apply is, okay, you have to go to www.bmlcollege.com and go to the faculties. If you want to apply for um, level 3 diploma in health and social care, then you go to health and medical sciences faculty. We have 3 faculties and 9 schools. So if you go to health and medical sciences and select the School of Health Sciences, then you get to the School of Health Sciences. At the School of Health Sciences, we are focusing on preparing students to become leading healthcare professionals in the dynamic global healthcare industry. At the School of Health Sciences, we want to ensure you have the best learning experience possible and a supportive and nurturing learning community. Our courses are world recognized, CPD accredited, and provided by ambitious, well qualified, and experienced professionals who are committed to improve and inspire students to get beyond the textbooks and apply their learning into practice and in an innovative manner. So we are a team of professionals who want to develop the employability skills. So we are working with industry experts and also employers and agencies in order to get you best working experience after the graduation or during the graduation. We have work placements in place, and it is it should you sh- it's not for everybody, but selected work placement opportunities we have, and also apprentices and industry placements we have for the selected individuals. So you need to show your dedication and commitment towards the qualification as well, because it's very important. You put your effort. You need to earn your degrees with your using your own knowledge and expertise and improving and learning yourself. So if you go to um, level 3 diploma in health and social care, then um, you can access the information related to OTHM level 3 foundation diploma in health and social care course. This is very popular course among the students in the UK, because there's a lot of students are getting sponsorships looking for sponsorships in the health and social care sector. So what we recommend is to go for this RQF level 3 qualification, then look for opportunities in the UK care home sector, also maybe hospitals. A lot of students are getting into opportunities. So at BML, we are trying to get some opportunities for students as well, but sometimes it's not for everyone that is selected. So but we are trying our best to get you as many opportunities for our students as we can. But most of the time, students with their dedication, with their skills, with their knowledge that they have developed throughout the program, they are finding better opportunities. So which we are proud about it. But maybe some of the students are finding it difficult to get into a work placement. In that case, we encourage them to get repeated interviews and then find for opportunities elsewhere in other countries. And some of the students are applying to move to other countries for better opportunities. It is, or we are at BML, we are trying our best to help you to get better opportunities through education. We are we are here to build a greater community supports and giving our students the best services that we can to get into job opportunities, and we give the references. We help them finding better opportunities applying for NHS, and we help them to do their CV and we do mock interviews, and we guide them through how to do the cover letter and how to find opportunities. So our, our education system at BML is not only we are encouraging you to get the paper qualification. Yes, it matter as well. But then again, what matters the most is who you become is what we need at BML. So we are changing communities, we are empowering students, and we are proud about what we do. And we want more and more students to get these facilities and make sure that they are gaining the world's like these are RQF qualifications are necessary in order to find better opportunities in the market. So we are inspiring our students to develop their employability skills and become the best version of themselves and apply for many opportunities they can. And we are also giving some opportunities for our students to find and go. We arrange some interviews, but it's up to them again when to try and pass these tests and interviews, the aptitude tests, and grabbing these opportunities are up to the student. But we are trying our best at BML to get you the best opportunity in the market. So if you're someone who's looking forward to start studying health and social care and you don't know where to start, or you think it's going to cost a lot, and maybe it is going to consume a lot of your time, and if you think that there are exams to do, so much stressful work to do, then don't worry. At BML we have made it very simple. We are giving the students more support, and also there's no exams to face, there's no stressful exams. It is assignment based and it is work based. So if you are someone who is already working in the care industry, then this is exactly what you need to do. So go join these courses. These are academic courses with 60 credits. So you can once you complete a level, then you can complete the next level in the education, such as level 4 diploma and then level 5 diploma, like that. There are lots of opportunities if you want to start start studying at BML. So we are very flexible, and you can do part-time, full-time, or distance learning method, or we also can do a blended learning method, and you can complete these courses within 3 to 6 months. We have intakes in January, April, July, and August. The fee is £2,000, but then we give you 50% off for health and social care students, because we believe we have to support the industry, as well as we need to support the people to for affordable tuition. So we are going to give you up to 50% off scholarships for students who are finding it difficult to pay the full fee. So apply to admin@bmlcollege.com. We can revert back to you with your affordability, so then we can do an assessment and see whether we can offer you up to 50% off tuition scholarships. And also our courses are very flexible, so you can complete at your own pace and pauses. You are given access to the entire modules. Even if you pay by installments, you are given access to the entire 6 modules, where you have to complete the learning materials on the web, on the learning management system, and submit assignments for that particular subject to the system. So we will do IQA, EQA, and then you will get your certificates at the end of the program. So we need you to, it's very flexible, but then you are given full guided learning hours as well. So you there are recorded sessions, online sessions, live sessions, workshops, and students are given demonstrations and webinars, seminars at our Birmingham campus if you want to study blended learning. So if you want to study online 100%, that is also possible. You can do online 100% online and complete your qualification. Move to the next level, like level what a lot of students do who are already in the UK. What they do level 3, then after about 6 months, 1 year, they do level 4, they do level 5, and then they are going for the top up degree in the university one final year. For that, we have universities that we are working with. We are placing you to university top up, where students are then getting the university graduation, and then they can move up in the corporate ladder, maybe as a care manager, or as a health and social care manager or social worker, in any profession, managerial profession in the health and social care sector, they can move. So yeah, you can apply to study our courses, and we have up to 50% off for the students who are joining these days. So we have April intake, and we also have July and August intake. You can complete these qualifications within 3 to 6 months. So let me know what we can do, and you have to send your CV, or you can apply through the, if you click apply now, then you can send your details, and then a member of our staff from the admissions team will be in contact to get you the best experience of getting the enrollments and starting your qualification and complete up to completion of your qualification. And we have one-to-one sessions as well if you want to start. So let us know how it works, and what is your purpose of studying these, because these qualifications are well recognized, and you can use these qualifications to apply for jobs. RQF Level 3 Diploma in Health and Social Care. There are 6 mandatory units. You get 60 credits upon completing all these modules. The modules include, the mandatory units are the responsibilities of a health and social care worker, personal and professional development in health and social care, effective communication and ethical practice in health and social care, health, safety, and well being in health and social care settings, person-centered approaches, and effective handling of information. So these are mandatory units. Every unit has 10 credits. So you at the end of the program you get 60 credits, which is very important. And you can complete this qualification 100% online, and you have to submit. This is assignment based. This is 100% assignment based. There's no exams. You can submit the assignments, and we give you the guided learning hours and access to the LMS, and you can progress to the university. So if you are someone who has just finished O levels, you can start this course and then complete level 3 and progress to any university in the world. A lot of universities take UK qualifications. They accept UK qualifications as their entry criteria. So if you're someone who want to get into the university, then university pathway program, this pathway program enables you to get progress to any university in the UK or elsewhere. So yeah, if you want to apply to study this course, you can go to our website and click apply now. Then we will be able to get you the information. So I'm going to now show you uh, uh, um, some in video about what we play at the class. So this is just a sample video that we play at the class. So if you want to hear that, okay, let's go for that.
Exploration of the vital roles and relationships in UK health and social care. In this video, we'll move beyond simply listing job titles to analyze how and why these roles matter. Effective care isn't just about what one person does, it's about how everyone works together within clear boundaries and professional frameworks. A look at the main professional roles, the importance of teamwork, the difference between working and personal relationships, and how regulators shape daily practice. By the end, you'll see how these elements combine to ensure quality, safety, and dignity for those receiving care. Start by understanding why roles and relationships are so important in health and social care. Care is rarely delivered by just one person. Instead, it's a team effort with each professional bringing unique skills. When roles are clearly understood and coordinated, outcomes improve for everyone involved. But if roles are confused or fragmented, risks can increase and the quality of care can suffer. This is why analyzing these roles and how they interact is essential for anyone working in the sector. Modern UK health and social care is built on interdependence. No single role can meet all of a person's needs. For example, medical needs might be led by GPs and nurses, but social workers and support staff are crucial for social support. Rehabilitation often involves occupational therapists and physiotherapists, but it's the daily work of support staff and families that makes real progress possible. Registered care managers oversee quality and safety, ensuring everyone works within regulatory frameworks. When these roles are well coordinated, people receive better, safer care. Adult social workers play a key role in promoting rights, independence, and social inclusion. They assess needs under the CARE Act 2014, balance risk and autonomy in safeguarding, and coordinate multi-agency responses. For example, in cases of self-neglect, social workers lead meetings with housing, mental health services, and GPs to create plans that respect the person's choices while managing risks. Their analytical skills and ability to bring different agencies together are vital for effective, person-centered care. Nurses and GPs are at the heart of clinical care. GPs diagnose, prescribe, and coordinate referrals, while nurses implement and evaluate care, supervise support workers, and act as patient advocates. Their roles are complementary. GPs often rely on nurses' detailed observations from daily contact. Effective communication between these roles is crucial. When it breaks down, it can lead to delayed diagnoses or medication errors. Working together, they ensure that care is safe, timely, and tailored to each person's needs. Paramedics are often the first professionals to respond in emergencies. Their role has grown to include assessing whether hospital admission is necessary, which can relieve pressure on emergency departments. Paramedics' decisions directly impact patient safety, continuity of care, and how well community and primary care services work together. Their ability to make quick, informed decisions is essential for both immediate and long-term outcomes. Registered care managers are responsible for translating regulatory and professional standards into everyday practice. They shape organizational culture, staffing, and training, ensuring that everyone knows their role and receives the support they need. Managers also respond to inspections and complaints, and their leadership is crucial for maintaining high standards. When leadership is weak, serious failings can occur, as seen in some UK care home inquiries. Strong management is the backbone of safe, effective care. Occupational therapists, OTs, and physiotherapists bring a rehabilitative focus to care. OTs help people engage in meaningful activities and adapt their environments, while physiotherapists focus on movement, strength, and preventing falls. Their effectiveness depends on support workers implementing their programs consistently and managers allocating the right resources. This teamwork ensures that rehabilitation is not just a one-off event, but a continuous process that supports long-term well-being. Support workers are the backbone of adult social care in England. They provide most of the direct personal care and emotional support. Senior support workers add leadership on shifts, mentor new staff, and have detailed knowledge of individuals' preferences. Recognizing and valuing these roles is essential for dignity, continuity, and person-centered care. Without their dedication, the whole system would struggle to function effectively. Relationships between colleagues are built on teamwork, mutual respect, and shared responsibility. For example, two support workers on a dementia unit must share information promptly, coordinate tasks, and support each other emotionally. In a hospital ward, nurses, healthcare assistants, and ward clerks work as a team to manage admissions, discharges, and daily care. Effective teamwork reduces burnout and ensures that no one is left to manage alone. Supervisory relationships, such as those between senior support workers and registered managers, are central to governance and learning. Managers provide feedback, address poor practice, and identify training needs. Staff are encouraged to bring forward safeguarding concerns and ideas for improvement. Where supervision is absent or weak, poor practice can go unchallenged, which can have serious consequences for service users. Multidisciplinary teams, MDTs, bring together professionals from different backgrounds to plan and deliver care. In a community mental health team, for example, psychiatrists, nurses, social workers, psychologists, and support workers work together to support people with severe mental illness. In care homes, care planning meetings involve nurses, OTs, senior carers, and family members. These teams are essential for holistic, person-centered care, but require clear communication and leadership to avoid role conflict. Relationships with other professionals, advocates, and families are a daily part of health and social care. For example, a district nurse and a domiciliary care worker may coordinate visit times to ensure wound dressings and personal care are aligned. Legal advocates support individuals whose rights might be overlooked, especially when there are communication difficulties. Staff must also balance respect for family knowledge with the individual's autonomy and confidentiality. It's important to distinguish between working and personal relationships in health and social care. Working relationships are purposeful, boundaried, accountable, and collaborative. They are defined by job descriptions, contracts, and professional codes. For example, a nurse delegating a task to a support worker must ensure the worker is competent and provide clear instructions. Personal relationships, on the other hand, are based on emotional connection and are voluntary, not part of a formal contract. Personal relationships, such as friendships or family ties, are built on emotional connection, mutual affection, and shared interests. They are voluntary and reciprocal, not governed by organizational policy. In contrast to working relationships, personal relationships are shaped mainly by personal values and social norms. Understanding this difference is crucial for maintaining professionalism in care settings. Maintaining clear boundaries between working and personal relationships is essential in health and social care. There is often a power imbalance between workers and service users, and blurring these boundaries can lead to exploitation, favoritism, or breaches of confidentiality. For example, accepting gifts or money from a service user can undermine trust and lead to unequal treatment. Professional boundaries protect both workers and those they support. Regulators set the standards for health and social care and hold organizations and professionals to account. The Care Quality Commission, CQC, regulates services in England, inspecting and rating them, and taking enforcement action when needed. The General Medical Council, GMC, regulates doctors, while the Nursing and Midwifery Council, NMC, oversees nurses and midwives. These bodies ensure that roles are clearly defined, training is up to date, and misconduct is addressed. The Care Quality Commission, CQC, is particularly influential in shaping daily practice. It sets fundamental standards around dignity, safety, and person-centered care. Registered care managers, nurses, and support workers must all work within these standards. The CQC's inspections and reports help drive improvements and ensure that care remains safe and respectful for everyone. NHS Improvement and NHS England oversee the performance of NHS providers, focusing on quality improvement and financial sustainability. Their frameworks influence staffing models, governance, and quality systems across the sector. By setting expectations and monitoring outcomes, they help ensure that care is both effective and efficient. The General Medical Council, GMC, and Nursing and Midwifery Council, NMC, are responsible for regulating doctors and nurses, respectively. The GMC sets standards for medical education and practice, while the NMC's code emphasizes person-centered care, communication, and safeguarding. These regulators ensure that professionals are competent, ethical, and accountable. General Dental Council, GDC, regulates dental professionals, ensuring safe and ethical practice. The Health and Care Professions Council, HCPC, oversees allied health professions, including occupational therapists and physiotherapists. Both bodies set standards for conduct, performance, and ethics, shaping how these professionals deliver care. HealthWatch England acts as the statutory consumer champion for health and social care. It gathers feedback from service users and communities, reporting concerns about quality, access, and dignity. Practitioners and managers should engage with HealthWatch findings to improve services and ensure that care is responsive to people's needs. The National Institute for Health and Care Excellence, NICE, produces evidence-based guidelines and quality standards. These documents inform local policies, clinical pathways, and care planning. By following NICE guidelines, GPs, nurses, therapists, and support workers can ensure that their decisions are based on the best available evidence. Other bodies, such as local safeguarding, adults boards, professional associations, and commissioners, also play a role in shaping expectations and standards. Workers must understand the specific regulatory context of their service, whether it's mental health, learning disability, or domiciliary care, and align their practice with current guidance. Interaction between roles and relationships directly influences the quality and safety of care. When professionals communicate well, respect boundaries, and follow regulatory guidance, people receive safer, more effective support. Conversely, poor communication or unclear roles can lead to mistakes, risks, and even harm. That's why continuous learning and reflection are so important in this field. Person-centered values are at the heart of health and social care. This means putting the individual's needs, preferences, and rights first. Every role, from support worker to registered manager, must work together to ensure that care is tailored to the person, not just the process. This approach leads to better outcomes and greater satisfaction for both service users and staff. Safeguarding is a shared responsibility across all roles in health and social care. Staff must be alert to signs of abuse or neglect and know how to report concerns. Managers provide training and support, while regulatory bodies set the standards. Effective safeguarding relies on clear communication, strong supervision, and a culture where everyone feels able to speak up. Continuous learning and development are essential in health and social care. Staff must keep their knowledge and skills up to date, while managers identify training needs and provide opportunities for growth. Regulatory bodies often require ongoing professional development as part of maintaining registration. This commitment to learning helps ensure that care remains safe, effective, and evidence-based. Strong communication skills are vital for all health and social care workers. Whether it's sharing information with colleagues, explaining care plans to families, or listening to service users' concerns, clear communication builds trust and prevents misunderstandings. Training in communication is a core part of professional development and is emphasized by all major regulators. Respecting the dignity of every individual is a fundamental principle in health and social care. This means treating people as equals, valuing their choices, and protecting their privacy. All roles, from support workers to managers, have a responsibility to uphold these values in every interaction. Regulatory standards reinforce the importance of dignity and respect in daily practice. Confidentiality is a key aspect of professional boundaries in health and social care. Workers must protect personal information and only share it when necessary for care or safety. Breaching confidentiality can damage trust and lead to serious consequences. Training and clear policies help staff understand their responsibilities and maintain high standards. Accountability means being responsible for your actions and decisions. In health and social care, this includes following policies, documenting care, and being open about mistakes. Managers and regulators expect staff to be accountable, as this helps maintain trust and ensures that care is safe and effective. Accountability is a shared value across all roles. Professional codes of conduct set out the standards expected of health and social care workers. These codes cover areas such as respect, honesty, confidentiality, and competence. Adhering to these codes is not just a legal requirement, it's a way of ensuring that everyone receives high-quality, ethical care. Regular training and supervision help staff stay up to date with these standards. Supervision is a key mechanism for supporting staff and maintaining standards. Regular supervision sessions provide opportunities for feedback, reflection, and problem-solving. They help staff develop professionally and ensure that any issues are addressed early. Effective supervision contributes to a positive workplace culture and better outcomes for service users. Conflict can arise in any workplace, including health and social care. It's important to address disagreements constructively, using clear communication and mediation where necessary. Managers play a key role in resolving conflicts and ensuring that teams continue to work effectively together. Training in conflict resolution is often part of professional development. Promoting inclusion means ensuring that everyone, regardless of background or ability, has equal access to care and support. This involves challenging discrimination, adapting services, and valuing diversity. Inclusive practice is supported by training, policies, and a commitment to person-centered care. It's everyone's responsibility to create an environment where all feel welcome and respected. Families play a significant role in supporting individuals who use health and social care services. Professionals must work collaboratively with families, respecting their knowledge while maintaining the individual's autonomy and confidentiality. This partnership approach helps ensure that care is holistic and responsive to the person's needs. Advocates support individuals whose rights or wishes may be overlooked, especially when there are communication difficulties or limited capacity. Health and social care workers often work alongside advocates to ensure that people's voices are heard and their rights are protected. This is a key part of ethical, person-centered practice. Clarity about roles and responsibilities is essential for effective teamwork. Everyone needs to know what is expected of them and how their role fits into the wider team. Clear job descriptions, regular meetings, and open communication help prevent confusion and ensure that care is delivered safely and efficiently. When working relationships break down, the impact can be serious. Poor communication, lack of trust, or unclear boundaries can lead to mistakes, low morale, and even harm to service users. That's why investing in positive relationships and strong teamwork is so important in health and social care. Continuous improvement is a core value in health and social care. Teams regularly review their practice, learn from feedback, and make changes to improve quality and safety. Regulatory inspections, audits, and service user feedback all contribute to this process. The goal is always to provide the best possible care. Ethical practice means doing the right thing, even when it's difficult. This includes respecting rights, maintaining confidentiality, and acting in the best interests of service users. Ethical dilemmas are common in health and social care, and staff must use professional judgment, seek advice, and follow codes of conduct to resolve them. Reflective practice involves thinking about what went well, what could be improved, and how to learn from experience. It's a key part of professional development and helps staff provide better care. Regular reflection, individually and as a team, supports continuous improvement and personal growth. To sum up, roles and relationships in health and social care are complex, but essential for quality, safety, and dignity. Each professional brings unique expertise, but it's the way they work together, within clear boundaries and regulatory frameworks, that makes the real difference. Understanding these dynamics is central to ethical, person-centered care. Ultimately, well-defined roles and constructive relationships are the foundation of human rights, dignity, and well-being in everyday care. By maintaining professional boundaries, collaborating effectively, and adhering to regulatory standards, health and social care workers can make a real difference in people's lives. Thank you for joining us on this journey through the responsibilities and relationships that shape UK health and social care.
That was some sample video that we play at our classes, and then we ask students to contribute their knowledge and experience as well. So we these videos are available on our learning management system if you want to start studying RQF level 3 foundation diploma in health and social care. Then you have to click BML college .com and apply to this course. Then a member of our admission team will be in contact to see whether you are eligible, because it is very important that you need to have um, a high school education, and if there is any experience and knowledge of English in order to get into these courses, because these courses are conducted in English. So it's very important you have the knowledge to in writing and reading, because you need to do the assignments in English as well. So BML College Online offers now 50% tuition scholarships for students who are finding it difficult to pay the full tuition fees. You all you got to do is to write a letter to admin@bmlcollege.com asking for the scholarships, explaining your financial situation. So we are supporting all the students who irrespective of their differences. So we are supporting all students to get into higher education, because we believe higher education should be affordable and accessible for all. So up to 50% tuition scholarships are available for all students. If you want to study RQF level 3, we also have level 4, 5, 6 as well. So if you want to study these qualifications, and RQF qualifications are recognized for any employment or to get into higher education courses in the university. So our students are either getting into the university or getting the full-time employment within 6 months of their graduation. So we have 97% of our students getting their job that they wanted, and also or if they are coming to do university pathway programs, then our students are getting into their desired goals. So many students, like 97% of our students are getting, so maybe it's about 2 to 3%. If they are finding it difficult to get, we are having support systems in place to support them as much as we can. So apply at bmlcollege.com. We have 24/7 support and access to LMS, and 100% online learning option is there. We have qualified teachers and a sophisticated LMS and also recorded learning sessions for you if you want to start studying at your own pace and process. Okay, I will play some more videos that we play at class, so you can understand like how the things work, and then if you get inspiration to apply to study at BML College online.
I always say, especially to ODPs and also other allied health professionals, is that HCPC do not look at the quantity of hours that you've done, they look at the quality. You need to make sure that you've got very good, substantive, wide range of CPD activities that you've been engaging in as well. And that's really important to just log it, not just to wait until the letter comes near when your registration is renewing.
I think people always believe it has to be about academic side of things. And there is an element of academia because you have to maintain a professional standard. But at the same time, I think a lot of it is about raising your awareness and knowledge and getting a very lateral view and a holistic view of everything that's around you. So being able to present your CPD in different ways, so to not only just to read the literature, but to communicate with others, to attend conferences and be more aware of products maybe on the market, new ideas. And to be involved. I think that's all CPD.
And also the different types of development, because it's not just about attending a course. You can read something, you can have a chat with somebody, you can have a situation where you've reflected on, you can do sort of simulation, they can also do bite-sized teaching as well, because we're so limited with time. So it's not just about learning, it's also about giving back as well.
I prefer the types of CPD where you're actively learning and participating in something and then carrying that back to real life, to the ward or to the OT team in general. So things like conferences or learning courses, or even having an experience with a patient and then reflecting on that and discussing that within our team, or something where we learn something, we all go off and do it with our patients or on the ward and come back and reflect on it and evaluate what's happened or how we're using a treatment or an assessment. So very much that kind of proactive learning and reflection rather than just reflection. But reflection obviously is very important as well, but I would prefer the more proactive, active learning kind of CPD tasks.
And sometimes I actually enjoy just attending a course. So it's all well and being that you're delivering it, but it's also good to attend courses to get information as well. So it's all different things, journals. I'm just about to have a chapter published in a medical book. So, and that was a big challenge, like doing lots of reading and research and then making it into a chapter that somebody will potentially be referencing. And on the HCPC, the website, and on the CPD list, it gives you such a wide range of activities that you don't even appreciate that is actually CPD, and it is CPD. Even watching TV programs, things like that as well. So it's a fantastic resource to use.
It's amazing how quickly your CPD actually goes up. If you're regularly attending things or regularly discussing, whether you're having supervision sessions, mentoring sessions, you're reading literature, all of these things I put down, and however minor they seem to you, it's a learning point and a learning curve in your journey. So I record everything, and I'm always amazed at how much I've learnt and how much I'm progressing.
So our support workers are important to us because without them, we can't do our job. We rely on our support workers very often to raise concerns to us because they are often the first people that see our patients when they deteriorate. Often the nurses might be on a drug round or busy with other patients or other tasks that they may not see those patients quickly. So our support workers will very often be the first people to flag any patient deterioration.
My name's Scott. I've been working in healthcare for over 25 years, and working at PHU has been the best 3 years of my life. I thoroughly enjoy it and would recommend it to everyone. I leave for work very early in the morning because I do travel quite a distance. I do long days, and my day is busy from beginning to end. I wouldn't have it any other way. I feel like I achieve a lot doing a long day rather than doing a short shift. And for me, it gives continuity as well, both for the patients and for the work with the team. Wanting to learn new skills, clinical skills, and also use my experience to help the community where I grew up. My matron at the time recognised the skills that I had to develop my role. I enjoyed my role as a support worker, knowing that I can support such a wonderful team that I work with, and also providing a high standard of care to the patients that need my help, knowing that I've got the skills to be able to deliver everything they need. I find that healthcare is built into you. You should be something that you find natural and want to do. It shouldn't be a chore, and it should be something that's safe for the patient and for yourself. Enjoyment is the key. Honestly, working on D7 West and the trauma orthopaedic team, they're like a family to me. They're an extension of my family. They're welcoming. They've been pretty much the highlight of my time here, as well as the patients. As a senior healthcare support worker, I've taken on the role of assessing for care certificates for new healthcare support workers. I enjoy the mentorship side of things. I enjoy showing new, young people coming into the profession what the job's all about, really.
I'm Kira. I've been a healthcare support worker for 4 months. A typical day for me is a long day. So I would come in and start off with handover from the night staff, and then to give out breakfast, and then move on to the washes and bed changes, and then help the nurses out and do some observations on all the patients. And then it gets to lunch, we hand out the next meal of the day, and after lunch we do the menus for the following day, and then give out dinner. I got into care to eventually become a nurse, and I know PHU offers a nursing apprenticeship, and the healthcare support worker role was a clear starting point for my journey. Previously working as a housekeeper, I wanted to have a role that had more interaction with patients and get more clinical experience. The role can be challenging and mentally draining, especially in longer shifts. Sometimes patients stay with us for longer periods of time. However, it makes it all worthwhile receiving personal thank yous, seeing improvements and being able to understand what they're going through. I love my role as a healthcare support worker because my team are all very supportive, and I can also find additional support from the pastoral team. Working as a healthcare support worker in our cancer wards, we are offered regular catch-ups, and there are also times set aside where I can share my difficulties.
I love our support workers because without them, we can't do what we do. They are the heart of this hospital and really do make a huge difference to not just the nurses but to our patients every day. Thank you for everything you do.
I'm passionate about compassion in healthcare because I believe that compassion is the one thing that we could be focusing on to change the culture within the NHS. So what is compassion? Well, compassion is that feeling that we've all experienced when we know that there is somebody that really cares for us. Compassion comes from that moment when we can see the world through another person's eyes. In healthcare, I believe that it comes from people who love their work and who truly understand why they do what they do.
Compassion is about treating patients with dignity, respect and empathy through your communication skills and through your actions.
It doesn't take very much. It can be a very small gesture that the nurse may do. I only this morning dealt with a lady that had come about 10 miles on the bus. She was elderly, she would have been entitled probably to have hospital transport, but she'd made her own way here. When she came in, she was cold, so a cup of tea, 2 biscuits, and she was much, much happier. And that little thing really does make a difference.
I think it's particularly powerful when we are feeling vulnerable in physical or psychological pain, or when we are afraid.
My son is bedbound for 6 weeks, so boredom is a big factor. So if he was just left alone in this room, he will deteriorate, become sort of depressed almost. So the nurses come in, cheery faces. They ask quite often, do we need anything? Even the dietitian comes in and they'll try and encourage him to eat by sort of giving him star charts and goals to aim for. So they're trying to encourage him to get better.
The consistent theme is that it is always the smallest things that make the greatest differences.
You hear so many stories nowadays about people being treated as a number, and it's my experience that the professionals that are looking after me really do seem to care about what's happening, what they can do about it, and keeping me informed as to how they're doing it. And once you have that information, that empowers you then to obviously deal with your illness as best way you can.
Not only that, it's all the staff, even the canteen staff, how good they are as well.
Compassion isn't just about talking to the patients, it's making them feel safe in a nice clean environment where they can feel at home.
They've really been so kind to me. They've made me comfortable all the time. I might be a bit anxious over something, but they soon sort me out.
So I see compassionate care being delivered when the staff themselves feel cared for, when they feel free to speak openly, free from fear, then they work together as a team and they trust each other. I think that the most valuable gift that we can give each other and to our patients is the gift of time. Time to allow the patients to speak about what matters most to them. And most importantly, time for the staff to listen.
I think you have to show a genuine interest in the patient without being judgmental. Try and find out a little bit more about their lives, their beliefs, their values, in order to empower the patient to be able to make decisions about their rehab and the goals that we're going to set together.
They often divulge all sorts of different things about their worries at home. It might be who's going to walk my dog while my leg's in plaster. And it's things like that that we can help to facilitate arrangements that make a big difference to how they experience their care.
I believe that if we focus our attention on things that matter most to our patients, then we will gain their absolute trust. This trust would improve clinical outcomes, would improve financial outcomes, would empower patients to improve their quality of life, would reduce their dependency on their system and improve morale of our staff. This has to be our number one priority.
The most important skills that someone needs to bring with them to be successful in a career in healthcare is compassion. And actually it's not really the skills, it's the behaviours and values that we're looking for. So we can teach anyone how to insert a catheter, how to take blood pressure, but what's much harder to do is to get someone to understand how to start up a conversation with a stranger who's in a bed, who they might not ever see again, to understand that it's the really small things that make a difference to those people, to be conscious about how they impact on their colleagues and how sharing information, offering volunteering to do tasks that might be quite minor, make a huge difference to how the team operate and then to the quality of the service that we deliver.
The most important skill needed for a career in health and social care, I would say, is having a good communication skills. We work in a very multidisciplinary team, and having the good communication means that you be able to speak, sort of have good contact with your team members, and also give some sort of sense of belonging to your patients who are not even actually able to speak for themselves.
Respect is really important in health and social care, and I believe it's important in any industry that you choose to go into. Just knowing how to speak to somebody, or whether it be a patient, it's so important. I think that's the fundamental thing, respect.
So today we discussed about some aspects, some learning materials, and some videos we watched, what we play at the class. And I hope you got the information about how to start your qualification and what you're going to learn. There are 6 mandatory units that you have to learn. Join us to study RQF Level 3 Diploma in Health and Social Care. You can do it online, on campus, or blended learning. You can do distance learning. You can do part-time, full-time, or at your own pace. We are here to support you. Some of the students are completing this qualification to find employment opportunities in health and social care setting. Some students who are having already experience wanted to start this academic qualification in order to move up to in their career and to get a top-up degree from the university, from any university. So once you complete level 3, 4, 5 diploma in health and social care, we are placing you with the university final year top-up, and you are eligible to go for the final year top-up when you graduate with us. So let us know how we can help. So thank you so much for joining today's session, and I'll see you another day with another session, what important information about what we can do at BML and how you can join with BML College. So I encourage you to apply to these courses to study online at BML College. Go to bmlcollege.com and find your faculty, find your course, and apply, click apply now. We are here to support BML College. Awaken the genius within.